Oxford, as many people will know, is a pretty affluent place, and Oxfordshire, the county, is also quite affluent overall. But actually, as with many big towns and cities in the UK, there's actually a lot of inequality, and there's a great deal also of health inequality. And my focus now with SCW is specifically on health improvement and inequalities. So although we're in Oxford, a rich city that people are familiar with being affluent, in fact, here and in other parts of the county, like in Banbury, there are real pockets of deprivation. And how that translates into health is some really big disparities in health outcomes for people. So in Northfield Brook, a man might expect to live just to 75 years. So there's a lot of talk about ideas like levelling up and build back fairer, build back better. What does that mean for the NHS? What part do we in the NHS have to play? And in particular, the role of integrated care systems and integrated care partnerships, and the NHS working with local government and with other public sector bodies, with the fire service, with the police, but also crucially with the community and voluntary sector. And a lot of that has to happen at a place level, more locally, at local authority level, and right down to community level and to neighbourhoods. And that's particularly important for the role of primary care networks, having an impact not just on healthy living, things like diet and alcohol and exercise, but also on the social determinants of health, issues around housing, the built environment, travel and transport, and employment.
We know that COVID has brought about the health inequalities into the front. And as a PCN, we've been working really hard with local authorities and the voluntary sector to make sure that we're reaching out to our vulnerable residents and keeping close contact with our nursing homes and our learning disability homes, which we have 3. What we've looked at is our PHM data, and it's been really interesting. It's shown the difference between our deprived areas. So we've got postcodes that are deprived compared to the rest of our PCN. And in that, we've noticed that there's higher HbA1cs, higher blood pressures, increased smoking status, there's higher use of medical services, and also higher unemployment. Where are your priorities? Where do you need to go? And it's particularly useful because practices know their populations, but it's about what's missing that you're not picking up. And then build on what's already happening in the community. Link with your voluntary care organisations, link with your engagement officer at the council, and build on that. And then go to communities to say, what do you need, not what we think we need. And using your ARS staff and reaching out to the populations, I think that's really the key. And what I found personally is that the strain of general practice and the kind of roller coaster that we're all on, this has brought me to find that joy back in working with communities and helping to build these inequalities. So it's brought that joy back into general practice that maybe is quite difficult with the demanding capacity at the moment.
If you're going to the virtual NHS Confed conference this year, SCW is running a panel session on Wednesday the 16th of June at 12:45, and we've got a great panel of people. We've got Fiona Edwards, who's the lead of the integrated care system, Frimley Health and Care. We've got James Williams, who's the Director of Public Health for Medway, and we've got also Dr Rupa Joshi, GP and PCN lead from Woodley in Berkshire West.